Hello everyone, I'm Clay Larkin. Very excited to be here today, glad that you all made it. By 2020, 50% of Americans could be at risk for osteoporosis. That means that next year alone, approximately 100 million Americans are at risk for fracturing. Bone biopsy technology currently lags behind the market demand as there is no dedicated bone biopsy needle on the market. Biopsies done today are done using either a repurposed manual bone marrow biopsy needle or by using orthopedic bone drills. We do have imaging technology. The most advanced imaging technology we have thus far is called the DEXA scan. It can measure bone mineral density. However, even the most advanced imaging technologies cannot give us a completely accurate state of the metabolic state of bone. Bone biopsies are the gold standard in diagnosing of metabolic bone disease, yet the technology is simply found lacking. Our answer to this problem was to design a brand new dedicated bone biopsy needle. The design does contain a proprietary cutting edge as well as a three-part design meant to streamline the insertion of the needle into the bone, the coring of the bone, and then the removal of the bone core. It is designed also to work in conjunction with a power drill that already exists on the market today. We have a two-part design, or two things that I would like to emphasize is the size of it. So it needs to be large enough to preserve the microarchitecture of the bone, but it doesn't need to be so large that it causes undue trauma to the patient. The cutting edge is also very important because the way it is designed, we have hopefully eliminated the artifactual damage within the bone as well as thermal injury to the surrounding bone. Diagnosing bone disease is just diagnosing alone is currently a $544 million a year in the United States alone. Osteoporosis results in over 9 million fractures per year. For reference, that is approximately one fracture every 3 seconds. Treatment and pharmaceuticals of treatment for bone disease is a rapidly growing market, and it's because we have a very quickly aging population and a high prevalence of bone disease. We also have higher rates of cancer and obesity. Here are two current competitors that are on the market. Keep in mind that both of these needles were originally designed to do bone marrow, and so they were less interested in what it did to the actual bone. In blue, the Jamshidi needle is a manual device. Fewer and fewer physicians are willing to be trained on it because it is rigorous. And then in the orange there, you do have a power drill device. It produces a very small bone core, and it also produces several artifacts within the core. Just to highlight our design and how it is different from what exists, we will use an electric drill. It is the correct size for what we need. There are no damaged artifacts within the bone, and then it is designed specifically for bone. Our team, my formal training is in architecture and engineering. Dr. Rao is an associate professor of medicine at the University of Kentucky College of Medicine. She is also a practicing nephrologist with several years experience in bone biopsies. Dr. Lima is a scientist that works at the University of Kentucky Department of Nephrology. She works closely with clinicians to analyze bone data. And then Dr. Maluka is our chief of nephrology. He is a world-renowned expert in his field and has pioneered biopsy techniques and interpretations. So we need to expand our team. This is not an all-inclusive list, but it does get us a start. We need a technology partner, and what that means is we need someone precision engineering, instrumentation engineering. We are open to funding opportunities to continue research and development. Ideally, we would like someone within the medical device industry, somebody that has experience or knowledge with taking something from a prototype to market. And then I'll conclude with this. This is where we're at, where we're immediately going. So as I said, we are here to build our team. We have received a provisional patent. We have multiple NDAs in place with multiple companies that we've already spoken with that have expressed interest in helping us get to prototyping. And then our next tangible goal is to get a working prototype so that we may begin functional analysis. Thank you.